Research Director with the IFOPA. I was just reflecting yesterday that this is actually my 5th family gathering meeting that I've attended in the last year and a half. And I'll just say that it's such a humbling experience and such an inspiring experience for me to attend meetings like this. And frankly, this is where I go to really learn about FOP. So it's my privilege to be able to speak to you about how the IFOPA supports research. I'm willing to venture that most of you, when you think of the IFOPA, you really think about our support services. Hope did a wonderful job on Friday night talking to you about some of those services that we provide, whether it's our resource guide, our mentoring program, or even organizing opportunities like this for families to come together. However, most people don't realize that we actually put a lot of resources behind supporting research for FOP. Michelle pointed out our mission statement, and it's actually in the front part of our mission statement. I think we have a few steps before we find a cure, but we're working as hard as we can to first find treatments and then eventually a cure for FOP. So those of you who know me know I like to think in analogies, and as I was thinking about this talk with you, and I was thinking, how do I describe how the IFOPA supports research, this image came to my mind of a house and pillars, and I was starting to think about this image, and I sat down in PowerPoint, and I came up, instead of the house and pillars, I came up with something that looks more like the Athens Acropolis. So my apologies for my work, but hopefully you'll get the image and the analogy I'm trying to make here. The IFOPA supports key pillars in FOP research. And by putting our resources behind these key supports, what we're really doing is we're building a foundation for other researchers to come in and do their jobs more effectively and to be able to advance the science of FOP. And those groups of support happen to fit into 4 what we're calling pillars of support. The first one is around, FOP connectivity or collaborations. That's bringing our researchers together to advance the science of FOP. The next group is around research tools. We want to be able to provide our researchers with the necessary tools and make sure their toolbox is as full as possible to do their jobs. We also provide, I'm sorry, it's hard to see, research funding. So we'll provide research funding to help support everything from basic FOP research all the way to new drug discovery, and we do quite a bit in that area. And then finally, you saw a lot of presentations yesterday with pharmaceutical companies. IFOP is actively engaged in working with each one of those companies who are looking to bring drugs forward for people with FOP. So before we talk a little bit about each area, just in a little bit more detail, don't worry, it's not too long of a presentation. I thought we'd just have this a little bit more interactive, and I wanted to have a quick quiz to see your level of knowledge in terms of some of the research tools that we're providing. So the question is, biobanks are used for the following purposes. A, supporting basic research. B, screening future drugs. C, finding new biomarkers, which are just really indicators of your health. If you're healthy, sometimes markers will go up or go down and helps researchers. Or D, all the above. So you can either nod your head or just raise your hand, and I'll look around and see what the room consensus is. How many of you think biobanks do A, support basic research? Okay. What about B, screening future drugs? C, finding new biomarkers? Hope you can't raise your hand twice. I'm watching. or D, all the above. Awesome, awesome. So you guys got it. I think I'm authorized, Michelle, to give everyone 100% on your short test. So nice job. Yeah, indeed, biobanks help provide a wide array of support for research purposes, and we'll talk a little bit further. So nice job. So the first pillar I'm going to talk about, and just so if you're wanting to get to lunch really quickly and you're anxious, you can follow where I am in my presentation by the color of the pillar. So we're going to go through all 4 pillars. But the first one is around FOP connectivity or FOP collaboration. So the IFOPA supports an international scientific meeting for FOP, and is frankly the only meeting of its kind for FOP research. We just had our third meeting last fall, and the first one outside of the United States in beautiful Sardinia, Italy. And we had 180 people attend this meeting from 20 different countries, which really shows you how international FOP is. We're here in the United States, but this research is all over. It's really expanded across the globe. We had a great cross-sectional of attendees, so we not only had FOP researchers, we had clinicians who treat FOP, we had representatives from pharmaceutical companies who participate in these discussions. We had even regulators from the European Medicine Agency, which is like our FDA, and we had people from the community attend this meeting. It was a 2-day meeting. We had 30 presentations and 2 panel discussions. And as the name kind of suggests, Drug Development Forum, this is really about the science of FOP from very early all the way through drugs coming through the pipeline and getting ready to become future medicines. So I'm a kind of a research geek. I like the presentations, but the secret behind this meeting is not necessarily the presentations, it's really the connectivity and the collaboration. It's about bringing these researchers together, okay, to spark new ideas and to both build and foster new collaborations. Because at the end of the day, that's how research gets done. It's not a single person sitting in their lab researching FOP. It's about collaborating together with other researchers. And indeed, you can see that in one of the attendee quotes at the bottom. So we added 2 other points of connectivity this year for our researchers. The first was an FOP Immunology meeting. We know that one's immune system is involved in FOP, but we've really never had a concerted look together across multiple researchers looking about how one's immune system affects FOP. So the IFO PA teamed up with UPenn's Dr. Shore and Dr. Kaplan to host a 1-day meeting this past summer. We had 18 researchers there from 6 different universities. And when I think of the most interesting thing about this meeting is we had 9 expert immunologists, so people who study one's immune system, and they had very little knowledge about FOP. And we sat those 9 expert immunologists next to 9 expert FOPers, and the resulting discussion was truly enlightening. We had a lot of great research ideas generate, a lot of unique questions that were being generated, and as a result of this meeting, we had several researchers submit grants for research funding to study the role of FOP in immunology further. So you can kind of see that connectivity where you bring people together and ideas get sparked. The next is our FOP Biomarker Consortium. We just had our 2nd meeting 2 days ago. So biomarkers, again, are indicators of health. You know, sometimes they'll go up or go down in response to disease. And people use biomarkers. Researchers will use biomarkers in their basic research. People who run clinical trials like to use biomarkers. They can assess how their drug is doing. They can see whether biomarkers are going up or down in response to their drug. And eventually, biomarkers can even be used by your clinician to see how you're doing and also to better manage your care. So biomarkers have a variety of uses, but unfortunately in FOP we don't have a biomarker today. And given all these uses of what a biomarker could potentially do, we felt it was important to bring together all of our researchers that really focus on this research gap and get the team together to really kind of drill in and see what we could do to find novel biomarkers for FOP. So moving to our next pillar around research tools, and the first tool I just want to mention briefly is our FOP mouse model. So if you have a drug, and you're a researcher, you have a drug, you think it might work, whether it's in diabetes, it's in hypertension, or even in FOP, one of the things you want to do, and you heard this yesterday, is you want to be able to test it in animals, and you'd prefer to test it in animals that actually have the human form of that disease. Now, there are FOP mice out there. You saw several presentations yesterday showing some data in mice. But if you are a researcher in a lab that doesn't have these mice, there's a lot of experiments you can't actually do. And it's not that we don't have labs that want to share. It's just sometimes difficult or sometimes lengthy to be able to share those mice. We heard this over the number of years, that the challenge of getting access to this important tool So that's why the IFOPA decided to start its own mice colony and be able to share that with researchers around the world. Our mice have the R206H mutation, which is the most common mutation in FOP. So they do express or show heterotopic bone. So this way our researchers can test their new medicines in mice, and they can also study FOP further. Really proud to announce that the mice are available starting this month. They just became available to researchers around the world. You're hearing it actually probably before other researchers even know this, so this is kind of hot off the press. I just want to acknowledge that this is in thanks to Dr. Daniel Perrin at Vanderbilt University, who's housing these mice at his institution on behalf of the IFOPA, so it's really a tremendous collaboration. So next tool, and this is a tool, is our FOP Biobank. You've heard a lot about our biobank. This is a wonderful way for you to directly participate in research. By giving your urine, your saliva, kids' teeth that fall out naturally, please, in blood, you're giving researchers really important tools. And we went through it, everything from studying basic research, finding new biomarkers for us, or even screening new drugs. These biobanks are really powerful tools for our researchers, and samples are limited for researchers. So we are collecting this weekend for our biobank. Hopefully you've received some information. If you've received it and you didn't have the time, you weren't sure what it was, you were a little intimidated, that's okay. You can actually donate any time during the year. We're setting this up so we can get you sample collection kits sent to your house. You can fill it out. You can submit it whenever you feel comfortable. And then we even pay for the postage to send it back to the lab. So there's 2 points I want to make about our biobank. First is you don't need to have FOP to donate. We actually need controls. I'm on the donation list at 12:30 today. I know the list is pretty full. If you'd like to, please knock me off. Come speak to me. I would love to give up my slot for you, and I could donate later. So there's a 12:30 slot. My name's on there. Just either come up to me or cross me out, and I'll see you there, and I'll let you go because you're far more important to donate than myself. The other point I want to make is longitudinal samples, meaning the same person can give multiple samples over time. Not only can you, that's kind of the holy grail of biobanks. If we can get samples from the same individual over time, you're giving us like the holy grail. You're giving us that like crown jewel that we need, and this is really super helpful. So even though you donate once, thank you so much, you could donate again, that really helps us. So again, just another example of great collaborations. This is in collaboration with, again, Dr. Daniel Perrin at Vanderbilt University. I'm really appreciative because this way I don't have to store urine in my freezer. So I'm really appreciative of Dr. Perrin for housing all of our samples and curating them and making sure they're stored correctly. This is also with Dr. Shao at UCSF. Big support from Dr. Shore and Dr. Kaplan at UPenn, and Bob Pignolo at Mayo. So biobanks are not cheap to maintain and to build, so we went out and solicited corporate support. So I just want to thank our corporate sponsors, Regeneron, Blueprint, who are really funding this to make this possible on your behalf. So big thank you to them. So today, Biobank, we're just this month launching our Biobank, and we have to start somewhere, so we're starting in the United States. But we recognize that people outside of the United States will want to donate to our biobank. So we'll be expanding regionally in the future. So we want to make sure that everyone around the world can actually donate and participate in research. So FOP Registry, so what do I want to say about the FOP registries? You've heard a lot of mention about the FOP Registry. The IFOPA puts a lot of time and resources in terms of this important assets. Marianne Fitzpatrick, who I'll call our registry guru, who is going to come up and talk about the registry in a lot more detail. So I don't want to preempt or take the wind out of Marianne's sails. But I just want to make one quick plug here that, you've heard a little bit of reference, and just to hit on the point that Dr. Grenwell mentioned, that registries are really important assets, specifically in rare diseases because there's so few of us, and that we need to get that data together. And it's really powerful if you participate. And the only way we can get information out is if we get information in. So I strongly encourage you to participate if you're not doing so already, because again, these are really important tools in rare diseases. But Marianne will walk through that in more detail. So we're moving along. We're now on our third pillar of research funding. So the IFOPA does provide research grants to academic institutions. And there's no institution that IFOPA has supported longer than the University of Pennsylvania, UPenn. This actually started in the 1980s when our founder, Jeannie Pieper, collaborated with Drs. Kaplan and Zasloff on the FOP Collaborative Research Project. And this relationship continues right till today, where the IFOPA provides a lot of grant support to Drs. Shore and Kaplan to help fund their Center for Disease Research, which does great research, everything from basic research all the way to translational research. I'll just say it's a great collaboration that we have. We're very fortunate to have this with the UPenn team. But the IFOPA also has a competitive grant program that funds research for investigators interested in conducting FOP research. We started this program 4 years ago, really as a way to develop new treatment ideas for FOP. And the name of this program is ACT for FOP. ACT stands for Accelerating Cures and Treatments, which I think is a pretty good name for this program, and kind of well describes what we're trying to do here. We have researchers from all over the world who submit grant funding requests to us. And what we've done is we've paneled a group of experts in FOP, and you can see the team here on the right who will review these proposals and just help the IFOPA make sure we're funding the best research possible. In the 4 years that we've been running this program, we've made commitments of over $700,000 to FOP research, which is a truly pretty phenomenal number. It's really great to see this program grow each year. And it's only due in part by support not only from the IFOPA, but also national organizations. We have support from Canada, Australia, Italy, UK, I know I'm going to forget somebody, and the Netherlands recently joined. We have fundraising efforts that directly put research dollars into this program. And we also have the support of individual families. And just a quick call out to the Brinkman family who really helped to get this program up and running. So as a result of this program, the ACT for FOP program, we now have a pretty nice portfolio of research for FOP. We have 12 institutions, and I said I'd be very happy for my kids to attend any one of these 12 institutions. These are really great top-of-the-line universities. And 7 of these universities are actually looking at new treatment approaches to treating with new drugs for FOP. Early stage, but that's where research starts. As mentioned Friday night, the IFOPA also supports the UPenn Orphan Disease Center's $1 Million Bike Ride program. This is a grant matching program for specifically rare diseases. So this is the IFOPA's first time that we're supporting this program. And as a result of some great donations and pretty athletic cyclers, because I can't do what they did, we were able to raise $37,000. And with matching funds, we were able to put $75,000 back into FOP research in our first year, which is pretty good. So here you can see the Clementia team participating, and we can indeed verify that Christy Gonzalez did participate and wasn't on her couch during this, this bike ride. So last pillar is around supporting our pharmaceutical and biotech partners. So in a lot of respects, finding new drugs is half the battle. The second battle is getting these drugs through clinical trials to show they're safe and effective. And there really are no organizations that do this better than pharmaceutical and biotech partners, and this is why it's imperative that the IFOPA works hand in hand with these organizations to help bring these products forward in the most efficient way. We'll work with any organization, any company that is doing ethical research according to international standards, and I won't go through that because Dr. Scott did a wonderful job the other night. But some of the services we'll work with is we'll organize patient advisory boards. We'll provide direct community insight into their programs. The IFOPA will directly provide input into their clinical development programs and help with their design of some of their clinical trials. And we'll also help with trial recruitment. So we'll announce, you'll see some newsletters and through social media, we'll announce information about these clinical trials so you're aware of if there's any trial or enrollment criteria or trial participation opportunities in the area near you. We're also looking to redo our clinical trial webpage, which will have more up-to-date information on all the clinical trials going. So more on that site shortly. The other point, and this is my last point that I'll make, is that I'm also a resource here for you. I wish I had my email address on here and phone. Feel free, if you ever have any questions at any point on any topic, please contact me. I'm always available for you. Find me either here or contact me next week. At any point, I'm a resource here as well as for you if you have any questions. So I'm always happy to speak to you at any point. And with that, I think we've done our tour through the IFOPA Acropolis. I hope you found this a little bit useful and just gain a little bit of insight into some of the areas of how the IFOPA supports research. If you see Eris Economides, who's Greek, please don't let him know that I've tried to draw a Greek building because I'm sure I'll get a lot of criticism for that. Yeah.
I think next year our Saturday night party will have to be a toga party in
there
honor of this.
There you go. So thank you very much.
Yeah, thank you, Adam. He definitely works tirelessly in this area on your behalf and on behalf of the researchers. In the About IFOPA brochure that you have in your folders, all of Adam's contact information is in there. So you have an easy way to get in touch with him. Any last questions for Adam? Any questions?